evening, everyone. I'm Jeff Kulikowsky. Christy is off this week, and we begin tonight with a health alert. Just a few days from Christmas, and for another holiday season, we're dealing with illness, and a lot of it, more varied than we've seen the past couple of years, but it is sickness nonetheless. Let's bring in Upstate Global Health Director, Dr. Stephen Thomas. Good to see you. Thanks for joining us, Dr. Thomas.
It's good to see you, Jeff.
More guidance coming out about masking up again. What's your advice? Who, when, where?
Yeah, so masking is kind of a foundation of maximally protecting yourself against respiratory viruses, to include influenza and also COVID. So I would say that if you are somebody who really wants to maximally mitigate your risk of getting infected, then you should consider wearing a mask in public places. And I would certainly say that if you're somebody who's at risk of a bad outcome from either a flu infection or from COVID, you should absolutely consider wearing a mask in places where people are gathering and you cannot maintain your space.
COVID's starting to climb back up again, especially in this region. Flu is still very, very high. What's your advice to people when it comes to Christmas and other holiday gatherings, New Year's Eve, those kinds of things in the next couple of weeks?
Yeah, so the first thing is we have a bivalent booster vaccine, which people, if they've gotten the primary series, they should seriously consider getting vaccinated, and we're going to talk a little bit more about that. The second is that we have an influenza vaccine, which probably for the first time in a couple of years, we have a very good match between what is actually circulating out there and the strains that are contained within the vaccine. So absolutely get vaccinated if you can. Number two, if you're sick, you're going to have to bypass going to that event. You really should not be doing that. The third thing that you can do, and it's a conservative thing to do, but it's a smart thing to do, is people could test before they gather, right? These tests are still widely available, and you can get them in many places, many drugstores. So that's something you could, you could do, and try to keep the numbers down if at all possible.
And you can get both flu and COVID vaccine at the same time, right? It's very safe?
Yeah, absolutely. They've shown that it's safe, and it's just convenient. It's just easier to go and get them both at the same time and be done with it.
I've been wanting to ask you this one for a while, so let's get it out of the way before the end of the year. Paxlovid, still recommended if you have COVID? There seems to be a little bit more in the way of rebound, or is there another drug out there, or would you still go Paxlovid?
Yeah, so I know Paxlovid is designed for people who are at risk of, who are at high risk of having severe COVID, and they have mild symptoms at the time that they're diagnosed, and they have had symptoms for less than 5 days, and it has shown to be very effective in that population in reducing their need to go into the hospital, develop severe disease, end up in the ICU, or end up dying. You are correct that there is this rebound phenomenon. We're not really sure in what % of people it happens. Depends on what study you read. But even if it is at the top end of the spectrum of what people are reporting, could be 10%, something like that. It is still advisable that if you're in that high risk group, that you talk to your doctor or a clinician about Paxlovid and whether or not you're a good candidate for it, because it really does significantly reduce people's risk of ending up in the hospital.
Dr. Fauci's leaving public office after a very long and storied career. What do you think about when you reflect on his impact on public health? I don't know if you've had any interaction with him.
Yeah, he's been serving the nation for a really long time, and he's an infectious disease physician, and he's also an expert in immunology. He has overseen the National Institutes of Health and NIAID specifically within the National Institutes of Health for a long time, served many presidents. So yeah, it has been a pretty incredible career. I had the opportunity to work with him and work with his team when we were developing Ebola vaccines and also Zika vaccines. And yeah, I found him to be a genuinely very curious man. He's very collaborative. He clearly has a passion for learning new things and trying to figure out problems. And I would say that I still think he has plenty of gas in the tank. I don't think he is, as he has said, he's certainly not retiring. He's just going to be making his impact in a different organization.
Dr. Thomas, thanks for your time tonight. Have a very happy holiday.
Thanks, you too.
Thanks.